Thank you guys for joining me tonight. My name is Kelly Shaffer, and I'm here to talk about what may be a difficult subject for a lot of patients to bring up to their primary care providers or any physician, and that is urinary and fecal incontinence. This affects more people than you know, and it can be embarrassing to kind of discuss. It's a difficult topic for a lot of people. So tonight is just a presentation to let you know that you're not alone. We'll go over some of the different treatment options and hopefully just open up the dialogue for you to have some, good frame of mind for what is normal, what is not normal, and know that there's some different treatment options for you. So tonight we're going to go over how the bladder and the bowel work. We'll talk about the different care pathway options for different people. We'll talk about the various treatment options for both bowel and bladder incontinence. And then we'll spend a little bit more time on the nerve stimulator aspects of the treatment options. And then we'll do a brief question and answer session. We'll try to go through this, fairly quickly so that we can spend a lot of time on questions for you guys. The most important thing to know is how prevalent this condition is for US American adults. It is more prevalent than adults with asthma. 1 in 6 adults has overactive bladder, urgency frequency, leaking urine before you can get there in time. 1 in 12 adults has involuntary loss of their bowels. So you're not alone. Millions and millions of Americans have this condition. What's a normal part of aging? There are a lot of things that are normal. We don't move as fast as we used to. What's not normal is what we call bathroom mapping, knowing where all the restrooms are at Belk and Harris Teeter, knowing where all the good rest stops are. What is not normal is limiting your fluids before you have to go to events because you're worried that you won't be able to find a bathroom and you might have an accident. Having to use multiple pads or garments per day. So a little bit about how the bladder works. The bladder naturally wants to be empty. It doesn't want to store anything. It would rather be empty the whole day long. Your brain tells your bladder to store urine, and then when you get to a safe space, otherwise known as the bathroom, it lets it empty out. Anything that disrupts that brain-bladder pathway can cause disruption in the signals, and the bladder just takes off and does what it wants. So this can be things like injury to the spinal cord, memory issues, stroke, any neurological condition, any local damage to the bladder can all disrupt these nerve pathways and can lead to urinary frequency, urgency, and incontinence. Same thing with the bowels. The bowels are controlled by the brain. Anything that disrupts these pathways or causes local damages to the nerves can cause fecal urgency and fecal leakage. What causes incontinence? A lot of the things we've touched on, but also things you might not be aware of. Daily habits such as your caffeine intake, drinking spicy foods, alcohol intake. Some of the medications that you may be prescribed for other conditions such as water pills. Those will deliver a large volume of water to your bladder very quickly. Other things that can be part of aging, which would be reduced physical mobility, where you just physically can't get to the bathroom fast enough. And then anything that can affect the pelvic floor. So this can be pregnancy, childbirth, radiation to the pelvis for different cancers, any surgery on the pelvic floor, or any kind of injury. So there are 3 different bladder control problems that we're going to touch on tonight. The first is stress incontinence. Most people think of this as a condition particular to women after childbirth, but can also affect men, especially after different surgeries for prostate cancer. Stress incontinence is involuntary leakage with activities, coughing, sneezing, jumping on a trampoline. I hear women all the time, oh, I went to Sky Zone with my kids and I peed my pants. It was so embarrassing. It can preclude exercising. It can preclude running around with your kids. It can preclude going to Sky Zone. So this is one particular type of incontinence just caused by weakness of the urinary sphincter. A second type of bladder control issue can be urinary retention or not fully emptying your bladder. And some people will have the urge to go and just can't get it to work. The bladder muscle just doesn't squeeze anymore. Other people just have lost the sensation of having a full bladder. And this can be one of the late complications of neurological conditions or diabetes. Patients are not even aware that their bladder is full, and this can lead to conditions such as urinary tract infections. And again, this is usually just due to nerve damage. Overactive bladder. This is the I gotta go, I gotta go. You can't get to the bathroom fast enough. You can't get people out of the way when you're in line. You all of a sudden just start washing dishes and you have the urge to go to the bathroom. You can't get your pants down fast enough and you start leaking. It's going more frequently than you would like, more than 8 times a day. The sensation that your bladder is never empty, even though it is, you still have that sensation of needing to go. This is commonly what we call OAB, or overactive bladder, and this can affect men and women. Fecal incontinence. Now, this is something that people do not like to talk about or bring up, but it is very common. And fecal incontinence can be the urge to have a bowel movement and not being able to get there in time and having an accident. And there are also people that are not aware that they're having a bowel movement and it just comes out. But again, this can be due to radiation damage, pelvic floor damage, nerve damage. And this is a very distressing condition for a lot of patients, obviously. You see people, they wear dark clothes, they bring changes of clothes with them all the time, protective garments. It really can be limiting to their lifestyle. So now we're going to go over some of the different treatment options to help with these conditions and get your life back on track. So the different things that we're going to go through, first is the diagnosis, and that just involves meeting with a practitioner, discussing your symptoms, and kind of sorting out what type of bladder problem you have, whether it's the stress incontinence, not emptying, the overactive bladder, and then obviously the fecal incontinence is a different category. So first, there are some very basic things that we can do, and these are called lifestyle changes. And this might be modifying your diet, which can be, perhaps limiting caffeine for people with overactive bladder. For fecal incontinence, limiting some foods that may be stimulating to the gut. There are some physical therapy. We have pelvic floor physical therapists that work one-on-one with you to help strengthen your pelvic floor, help strengthen your sphincter. They can do bladder retraining. This is very beneficial after childbirth, beneficial after any pelvic floor surgery, and then just in general to help people know what a normal bladder and bowel sensations are. So it's a great treatment option for everybody. In particular for the bladder, there are some oral medications that can help with overactive bladder. There's no medication really for the leakage with trampolines. There are some medications we can try for the urinary retention that have mixed results. There are lots of overactive bladder medications on the market. They can have some side effects. Typically, these can be dry mouth, blurry vision, constipation, and they typically will have a high discontinuation rate for patients. Number one, because of the side effects, and number next, people don't like to take pills. So if we've tried the lifestyle therapies, we've tried pelvic floor physical therapy, and we've tried medications, we're going to talk about more of the advanced therapies. And these are kind of the next step. For bladder control, we have some nerve stimulation options and an injectable. For bowel control, it's really just the nerve stimulation option. So Botox, everybody's heard of Botox. We use it for wrinkles, but we also use it for a lot of other medical conditions, migraines, muscular diseases, and we also use it in the bladder. It is indicated for overactive bladder, the I gotta go type. It can be injected in the office. It is not a one-time injection. It does have to be re-injected typically every 6 months. Possible side effects from this can be an increased risk of urinary tract infections and possible having to catheterize yourself if you can't empty your bladder all the way. It does not do anything for the bowels. We have an in-office nerve stimulator. This is just for overactive bladder. I liken it to an acupuncture treatment. You come into the office, we put a little acupuncture needle behind your ankle bone, and it sends messages back up this nerve directly to your bladder to kind of calm the overactive nerve down. You do a series of 12, and if you have great results from it, then we space you out to do monthly or every other month sessions. And so this is a great tool for patients that have the time to come to the office. They're looking for something less invasive or wanting to avoid any kind of medication side effects. The downside to it is a time commitment for 12 weeks, coming to the office once a week, and then continued maintenance therapy. So there are trade-offs to anything. The third and final advanced therapy that we're going to talk about is the Medtronic InterStim system. And this is an implantable under the skin nerve stimulator that again helps to regulate that overactive nerve. And this can be used for both bowel and bladder. So if you have bladder problems such as not emptying your bladder or the overactive bladder, it will work for this. And also for the bowel leakage. And if you have both bladder and bowel, then this is a great option. How do we find if this is a good option for you? First, we meet, we talk about your symptoms, we look at everything else that you've tried, and then we would set you up for a simple test. The test is done at a surgery center. You get a little kind of twilight sleep, and we use an X-ray machine to just put tiny little acupuncture needles in your back. There's no cuts, there's no incisions. It takes about 10 minutes. And then you wear a tiny little, almost like a fanny pack around your waist for 4 to 5 days that keeps the little nerve stimulation going. For the 4 to 5 days that you wear this little fanny pack, you record your bowel and your bladder symptoms, and we see if you're having a improvement in your number of accidents, a reduction in your trips to the bathroom. And then we take it all out in the office. And if you have a positive response, then we can talk about a procedure to just implant it under the skin. Nobody would know you have it. It's on all the time. And the battery would last 10 to 15 years. This therapy has been around for 25 years. It is almost 90% effective for bowel incontinence, which is a huge win for people that have bowel accidents. It really is a lifestyle changer for them. In terms of the bladder, it's 76 to 80% effective for overactive bladder and urinary retention, which is incredible when you think about the efficacy of a particular therapy. So how do we know if these are right for you? Just involves a meeting, some questions and answers in the office, an exam. We kind of run through things that you've tried before, changes that you've made with your lifestyle, and then we can determine if this, therapy is a good fit for you and if we should proceed with the test. So now we're going to move on to any questions that you guys might have. That just concludes my little presentation, but we'll be here as long as you need to kind of go through your questions.
Hi, everyone. I'm Jennifer. I'm a local representative here in Charleston. Very, very excited that we get to work with Dr. Shaffer. She is truly an advocate for changing lives, like many, many lives. And you aren't alone. And that was like one of the first messages on the first slide. And Dr. Shaffer has helped many people with this condition. To make an appointment,